According to the National Institute of Health, 85% of people suffer from back pain, and just doing common chores around the house like raking leaves can trigger that back pain. Dr. Jack Stern, founder of Brain and Spine Surgeons of New York, is here to share with us ways you can relieve your back. Welcome, Dr. Stern.
Thank you for having me.
So how common is chronic back pain, and why does it seem to be so widespread? I'm sorry.
Chronic back pain is actually relatively uncommon. Most of us suffer from acute back pain where we did something foolishly and your back hurts.
So that can be triggered by any sort of activity, just raking leaves, common chores, is that right? Sleeping badly?
All of the above. We live in a society where we tend to be relatively out of shape. We tend to do more than we should, and we tend to do it repetitively. A bad combination. And in addition, most of us as a population are getting older, and all those confluence of factors seem to come together and leave us with what's really a silent epidemic of back pain.
And why does it seem to center in the back? Is it because people are not carrying themselves properly? Are they not? Is the weight not distributed evenly throughout their spines? Why is it centering in the back?
I think that's a terrific question, and probably there's no solid good answer to that. For one reason, some would say that man was never designed to be upright. I don't feel that that's absolutely correct, but we tend not to pay attention to our backs when we work out. When most of us, if you go to the gym, you see people working on their uppers, working on their lowers, working on their core, their abdomen, but very few people actually spend much time either stretching or actually strengthening their back muscles. It's that neglected area of musculature.
But would working on your core muscles, your stomach muscles, your abdomen, would that also help, since it is kind of connected in some ways to your back?
Absolutely. If you think about it as your body is a tent, and the wires that keep that tent upright, needless to say, the front would be your abdominals, the back would be your back muscles. So clearly, if you've got a stronger core, it's less likely that you will have back pain. And
what are some common exercises you can do to strengthen your back?
Well, there are a variety of back exercises. It's hard to describe them per se. Actually, if somebody wants to see a really good example of them, I would direct them to the Mayo Clinic website, where there are videos demonstrating those. Some are called the cat, where you lie on your hands and your feet, hands and your knees, and you bring your back up and down. Sometimes you lie on your back, bring your knee up to your chest. So there's a variety of back exercises that you can do, some even very subtly when no one's watching. For example, standing up against a wall and stretching your back, going up and down with your knees. So you can exercise it in a most subtle way, in a very active way.
And are there other ways of treating back pain? Let's say you are constantly a victim of this acute back pain. Are there ways to manage it and keep it under control?
Well, I think probably one of the most important things is trying to get a handle on why you have it. Most of us have it because we are out of shape and we do something repetitively. And so the best treatment would be to avoid those behaviors or be more aware of them, or strengthen your back so that if you're forced to do those behaviors, you can do them more effectively. Having said that, there are a variety of treatments as well for acute and chronic back pain that seem to be very effective. Some of them having to do with Eastern medicine, some of them having to do with modern Western medicine. Some of my patients have done well with acupuncture. I've seen patients who have done who get regular massage, which seems to help them. I find patients benefit from doing Pilates regularly, the stretching exercises, or doing yoga. In addition, there's also that mind-body connection, and I notice that people use it very effectively. In fact, I've used it myself, something called the Alexander technique, which is a method of using your thought process to realign your back and give you an intentionality in terms of when you're doing an activity. So there are wide varieties of both active and passive treatments that are very effective in treating back pain. I think probably the most important thing is intention, just remembering that your back is a fragile area and you can hurt it, and thinking more carefully about how you might avoid hurting your back.
And doctor, how do you know when this pain may have become something more serious, like a slipped disc or a pulled muscle, something that needs more immediate medical attention?
I think you started this interview by saying that 85% of the population at some point has back pain. That's a fact. But almost all that back pain is self-limiting, and if it extends beyond 6 weeks, I'd be concerned. Number two, if back pain is more than back pain but begins to radiate, say, down your legs, I'd start to be concerned. And I certainly would be concerned if that back pain then manifests itself in terms of difficulty controlling your bowel, your bladder, or you notice that your legs are weak. I think that then is more than back pain. Those are what we call the red lights, those signals that alert you to the fact that there may be a real underlying neurological disease more than just muscular back pain.
And doctor, is there any new research or treatment on the horizon that is targeting back pain?
Very little. The key element in back pain is making the proper diagnosis. That's always the vast majority of patients, because the disease is self-limiting, a diagnosis is never made. It's always assumed that it's muscular back pain, and it's treated with analgesics, sometimes bed rest, sometimes activity. The most impressive progress is being made in attempting to further diagnose back pain so that one can develop an algorithm, a real thorough scientific way of treating back pain. And needless to say, we know some of those, including CAT scans, MRI, myelography, and other tests that pinpoint the pain. I think once we pinpoint the pain, then we have some more modern techniques in which to deal with the
address
pain.
It. All right. Thank you so much, Dr. Stern, for that incredible insight into our backs.